Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
In 2011, the Mayo Clinic started a pilot program for adolescent depression called the Emerald Program. Now, that is short for Early Management and Evidence-Based Recognition of Adolescents Living with Depression. There's a reason why they call it the Emerald Program.
Emerald makes more sense.
Yeah, Emerald is based on a model of care that's actually used for adults with depression.
The Emerald Program aims to treat medical and psychiatric issues in primary care by looking at the whole person and catching problems early on. That makes sense. Yeah. Here to explain the Emerald Program is Care Coordinator with Employee and Community Health, Nurse RoxAnne Brennan. Welcome to the program, Roxy. It's nice to meet you.
Nice to meet you. I'm glad to be here today.
Nurse Brennan, it's very good to meet you because I've heard so much about you from my daughter Ariana, who has visited with you on multiple occasions, and so good that as she has gotten older and progressed and matured, you continue to talk with her, and she appreciates that very much, as do I. But she has always said to me, you got to have Roxy on. You got to have Roxy on your show. And so here's Roxy.
Well, why does there need to be a special program for teens? Is there issues that teens have that adults don't have anymore? Can we not remember back that far?
Well, absolutely. There is a complete difference between adult depression and adolescent depression. What we learned from Diamond, the adult depression program, was the more people involved in the intervention, it was helpful for their adult lives. Now, with adolescents, you have their own life and their own world. We also have family that we'd like to teach and ask any of their questions that they may or may not have about the disease of depression. The other part of this is also being supportive to the primary care providers for their own confidence in treating adolescent depression.
Now, when you talk about coordinated care as part of the Emerald Program, that's basically what you've just outlined for us. There are multiple people involved in the care of one individual.
Yes, absolutely, Dr. Shives. Collaborative care, care coordination is not new per se in primary health. It worked with congestive heart failure, diabetes, asthma. Looking at mental health, we also could address depression. Myself, as a RN care coordinator, would work with the primary care provider, child and adolescent psychiatrist. Dr. John Huxell is my supervising psychiatrist. Pediatric social workers that also happen to be right on the primary care floor, and any other healthcare professionals, be it here at Mayo or in the community. The care coordinator will be the liaison through all those specialties, first and foremost, meeting the patient's needs, the family needs, and then being supportive for primary care in any of the other specialties, keeping the patient in the right place in primary care, not sending them out to a specialty area.
So Ariana, for example, was referred to you from her primary care physician, and then you work with this team of individuals and give the patient what they need.
Correct.
Now, you weren't there. You don't have specific training for what you do, right? I mean, you were. Tell us how you got into the Emerald
now
Program.
You're going to age me. I have worked at Mayo. It will be 17 years in October. I am a psychiatric nurse.
Oh, okay.
I specialize in child and mental health and addictions, and I was brought on board for the Diamond program. And at that time, as Dr. Mark Williams suggested that they were thinking about discussing possibly trying a quality improvement project for adolescent depression. And I volunteered and was more or less tenacious, saying, let's try this, along with Dr. Marcy Billings was the pediatrician champion for Diamond and then again for Emerald. We started discussion, and it went from quality improvement project to pilot to now program. And we just, as you said, was 5 years in July.
So I just want to make sure I have this straight. The way that the Emerald Program is different from mental health care for teenagers at any other place across the country is that you help coordinate the care to maybe deal with other issues that are going on with the teen?
Mm-hmm. First and foremost, it starts with the primary care provider. If the patient has some signs and symptoms of depression and they meet the criteria for depression, which is a depression questionnaire, the provider will contact me. I come in and I ask some questions. We screen for depression, anxiety, mood disorder, along with any issues with alcohol or drugs. I gather a family history, social history from the patient and family. I present that to Dr. Huxell in my case. I bring his recommendations back to the primary care. All of that could probably take a good 6 to 8 weeks if that patient had to be referred out to specialty care.
Okay, so it makes the process a little bit more likely to happen because you don't
Absolutely.
have to send the patient out and then hope that the patient and or the parents will make an appointment with a psychiatrist or psychologist. You can just start that process when they're there for physical.
So obviously the program has been a success. It's been around for 5 years. And how has it expanded? How has it changed since 2011?
That's the exciting part, Dr. Shives. We started on one floor, a community pediatric and adolescent medicine in Baldwin. We were able to expand to family medicine at the Baldwin building. We have now expanded to the Northeast Clinic, and we'll be expanding to the Northwest Clinic, and we will be expanding to the Northeast Clinic.
Wow.
Hopefully, our goal is to have at all sites in the Mayo Health System, not just Rochester.
Pretty
Long-range
common
goals.
problem. I mean, you get a lot of referrals, right? And
Yes.
would you say that overall is depression a more common problem among adolescents than it is among the adult population?
In the literature, 70% of adolescents will have a depressive episode before they reach adulthood.
Wow, 70%.
70%. And of that 70%, 1/4 to 1/3 of that population will be treated or seek treatment, be treated. The stigma that goes with mental health still today, the lack of child and or adolescent psychiatrists overall, not just here at Mayo, in the country, and the comfortability of the primary care provider in treating adolescent depression.
Now, what do you consider a success? How do you measure whether or not whatever your goal is, and that is to help someone adolescent through depression? How do you measure that? How do you know if your program is successful?
We use a tool called the Patient Health Questionnaire, and it's modified for adolescents. When we discuss setting up this program, we know the liability of adolescent moods, and we wanted a good, strong amount of time. So for 12 weeks of that score, which is considered in remission, and that's under 5, that is on paper what we look at for remission and, per se, graduation from the program. However, 50% of a 50% decrease of depression symptoms, to me, is a positive outcome.
Absolutely, especially for teenagers.
Absolutely.
It's a troubling time.
The quality of life. I try to contact the adolescents every other week. Sometimes it's weekly. Sometimes it's monthly if I cannot get a hold of the busy adolescent. But to keep engaged, if nothing else, just for them to know that there's someone there that is concerned, can talk with them, discuss issues, problems, relook at goals.
Yeah, well, it's a terrific program, RoxAnne. Thanks so much for all you do for the adolescents that you treat, and also for my daughter Ariana, who just thinks you're the greatest. It's the Emerald program, and Dr. RoxAnne Brennan has been our guest. Thanks so much.
Thank you.
We're going to take a short break, and when we come back, we'll hear one patient's organ transplant story.
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.